So, any fever call?
From the moment you set foot into Humber River Hospital,
Morning, no change. Nope.
in the emergency department, and throughout the intensive care unit,
and then connected straight to the vent.
signs. These are extraordinary times, and they call for previously unimaginable measures.
We're going to take good care of you.
These nurses are being reminded how to handle the bodies of those who have succumbed to COVID-19.
So if there is any COVID patient who dies, so we have to do the double bag the body.
Just label it COVID, she tells them.
When he came up, our first patient, I think we were unsure of, what the outcome's going to be.
The first COVID patient to be intubated at Humber River Hospital is this 51-year-old man. He presented with typical respiratory symptoms, but for how long he remains on a ventilator, no one knows.
We have not had an early extubation like that on people on a ventilator, so...
None?
None, yeah.
So as soon as they're intubated, they just remain with the breathing tube for however long?
Our patient number 1 is still intubated, and that was a month ago.
Right now, he is stable.
I think the fact that as a team we're able to make sure that he's stable, he's cared for, and his family's updated on a regular basis, I think that for us are the biggest wins.
Another symptom of the COVID-19 crisis in hospitals, no visitors allowed. For the patients in the ICU, that means the prospect of spending their final moments isolated from loved ones, and that takes a toll on everyone.
And a lot of these folks are dying alone with our nurses, myself, our doctors, being in the bedside with them as we're video recording these end-of-life moments. And that's the most distressing because we as a society are scared of dying, and to die alone is one of our most fearful moments.
COVID-19 is a silent killer. As we showed you in the first part of this series, while being intubated, this woman lost a pulse for at least 10 seconds.
Just one, please.
Was there a sense at one point that, she could have died in there?
There is a sense. She did lose a pulse. We did have to do chest compressions, and yeah, that did happen. It is scary. It is sad.
It's hard.
Yeah, it is.
They put on layers of PPE as they prepare to battle the enemy. But global shortages present unique challenges.
And we do have significant shortages, and that in drugs to sedate and to paralyze patients. There's a world shortage, and also in the PPE.
Face shield?
Every single item must be accounted for. There is even a PPE marshal.
All right, wash your hands. My job is when they're coming out and when they're going in, we check and make sure that all the PPE is properly on.
Did this role exist prior to this pandemic?
No.
It
wasn't
needed. You didn't need it
It wasn't
all.
needed because that time we was always aware of and the PP is always available.
As Dr. Mandelswig intubates a patient, she puts herself at the highest risk of contracting the virus.
I wouldn't see my own mother, for example.
Is she worried about you?
Yeah, I think she is. I'm sure she is. And I'm worried about her as well. I think, everyone is worried about each other.
As we all stay home to reduce the spread of coronavirus, in hospital, there is no avoiding it.
Are most of the patients here right now COVID patients?
I have total of out of 16, I have 8 positives.
Now there are positive cases in 30-year-olds, and they are deteriorating and needing to go to the ICU and needing to be ventilated and intubated.
It is frightening, it is traumatic, but as Dr. Jamie Spiegelman points out, there are ways it can be controlled.
I think the key right now is social isolation, staying home, washing your hands if you go out, if you go to a grocery store.
The care and concern of these doctors doesn't stop when they head home. Dr. Brian Cho's wife is 6 months pregnant.
Thankfully, none of us had symptoms to warrant isolating within the household, but we're ready to do that as well.
At Dr. Mandelswig's house, they aren't taking any chances.
Just so that we have our separate spaces, just in case if I get symptoms, I don't infect him, and also that allows for me to just focus on coming to the hospital.
These frontline healthcare heroes have no choice. They live COVID every day. Caryn Lieberman, Global News.